Hi, I'm Sarah.
Hi, I'm Dr. Wutsky.
Very nice to meet you. Thanks for seeing me.
No problem. Did you find the place okay?
Yeah, actually, I used to live around this area, so it was really easy to find.
Oh, perfect.
Yeah.
Perfect.
Oh, perfect. So I'm just gonna get out some stuff for you to see today.
No problem.
So, do you remember a phone call at all?
Yes, you wanted to talk about an infant security system?
So I'm here today to talk to you about our infant security system to help with abductions of your babies and also just keeping them in the right place and everything like that within the ward.
Right.
So after a little bit of research, after speaking to you on the phone, we've kind of come to the conclusion that it will really help to protect your patients. And then it'll help reduce your cost with your security system right now.
Always a good thing.
So what kind of security system do you have at the moment?
We're currently just using a security team, so they protect our patients, and if there's any abductions or anything like that, they kind of go after them.
Okay, and is it working all right?
It's okay. Yeah. I mean, obviously anything could get increased and become better, so we're looking to that.
Yeah, and it's manpower, I'm assuming, and stuff, and are you having
Mostly.
a really hard time just keeping
track of everybody?
Yeah.
Yeah.
Okay. Okay, well, so I think we have some things to show you. So this is our new packages that come when you get the system. What happens is it's a unique mother-to-child bracelet compatibility. So what happens is one goes on to the mother, one goes on to the child, and it really helps give the patients a peace of mind. And it also helps lower the risk of child abduction. So it's a great and really unique system that we've been putting in place in many hospitals across the nation. And it really helps with the parents just kind of like sense that nothing's going to happen. They're really going to go home with the right baby, all that kind of fun stuff, right?
Yeah, right.
Okay, so do you want me to show you how this works, or?
Yeah,
okay, perfect. Yeah, so all these come in a package, and they're all completely numbered, the same number. As you can see, the same numbers there, and also on the bracelet. It comes with 4 different bracelets. So one goes on the mother, and then one goes on the baby's wrist, and then one goes on his ankle, or her ankle, I guess. And then there's a second one that goes on to the other parent.
Okay.
So each parent gets one, and then the baby gets 2. There's also this umbilical clamp, which goes onto the baby's belly button, obviously, and onto his umbilical cord. So that's another, it's also tagged in with everything else. So here, I'm just going to show you, it's really easy to open. Everything comes sterilized. It's good to go. And we work with you guys to show how it works.
Yeah.
So really easy. As you can see, there's the V right there. And so you just grab there and you peel it back, like most of your tools that you guys use in the ward.
Yeah.
It's pretty easy. So I just brought some of my different receivers. So what happens here is that when the baby's born, the receiver goes on to here, goes into this hole, and then what happens is, if I can get it in there we go. It sits like this on the baby's belly button, so it's touching the baby's skin.
Right.
And then you clamp it. And what's really good about our clamps is they're tamper-proof. No one can tamper them. No one can break them back open. You can't, with a couple of the ones that you may have seen before, they're pretty much, you could take a pin and crack them open again.
Right. Yeah.
So, which is not really good, you know.
Obviously don't want that.
No. So, what's super easy, to push down. So, the thing is that when it's on the baby's belly button, these are our clamps, and they also come sterilized. I just grabbed one out of my bag right now, but they also come in the sterilized packages. And it's really hard for, obviously, your nurses to try and clamp it off while it's against the baby's skin, right? So what we have to teach your nurses is to flip these upside down, hold on to it, and then it's just super easy to just put it on there.
Right.
And snap it in half. See? And then it just snaps right in half.
Right.
And then it comes off, and then you're good to go. Yeah.
Yeah.
So there was no way they were ever going to reopen it, right?
Wow, yeah.
Without cutting it through. So that's one of the things that we have for you. One thing that we've really noticed is tagging your patients the 3 times. So tagging them on their belly button, their wrist, and also their ankle. It gives you the advantage of the tamper-resistant bracelets. They'll not stop working, and it'll help, shut down the ward if anything does happen with the children. And it keeps them safe while reducing the time of manpower that you're going to be using. To searching for that person who has taken that child, right? So right when the alarms go off, the doors all shut down and lock.
Okay.
So really, there's no way they can get out.
Right.
So, which is great. So, Nabby, do you understand kind of how the security system works?
Yeah, definitely. How much does something like this cost?
So, it is a big investment. It's a huge investment. It's an investment in time and money. And that's understandable, and I understand that you're kind of wary about that. But we've really found in other hospitals that after like 2 to 3 years, just with the saving of manpower, the labor costs, and once the nurses get into the groove of putting it onto them, they found that your stats going down with the abductions, obviously, everything like that. And also, it just really helps reduce your costs and your budget goes down. So you get to save. So, I mean, it's a big investment, but in the end, you're saving money.
Right. Yes.
Yeah.
I am a little bit weary of the cost right now just because our budget is a little bit tight and it's at the high end of it.
Mm-hmm.
But obviously the safety of our patients is quite important.
Mm-hmm.
So it is something to consider, definitely.
Perfect. So do you want to keep thinking about it? What about, or I could come and speak to the board if you guys think you're really interested in seeing it, and I can put into a sample security program, and I can show you how it actually works, and we can actually run through it a couple of times so you can see how the nurses can react and how patients will react to it, and we can even attach it to, if a mother is willing to attach it to one of the newborn babies and just kind of show them and see what their response is in your hospital about it.
Yeah, I would definitely be interested in that. Obviously, like I said, cost is a huge thing, so if we could do a trial and error and see how it works, that would be great.
For sure. Awesome. So definitely, I know the safety of your patients is huge, and your budget, okay, I understand is getting up there. I understand that. So how about we make the date to talk to the board?
Okay.
And in about a week, are you busy right now?
Let me just double check. I think we have Monday today. We could do next Friday.
Okay.
Maybe at about 9 or 10 a.m. Would that work?
9 a.m. works great.
Okay. Awesome.
Okay.
I will talk with my board members and then we can set something up with you.
Perfect. Thank you
That
so
would be
much.
Great. Thank you very much.
Have a great
day. You too.
Bye-bye.